Are you at risk for prediabetes? 1 in 3 people have prediabetes. Prediabetes is when your blood sugar gets high enough to be out of the normal range, but not quite high enough to actually be labeled diabetic. And it's concerning because it can cause a lot of different problems. 1 in 3 people are pre-diabetic and they don't even know that they have the condition. You may not have any symptoms because we hear a lot of people say, but I feel fine. I don't feel any, like I have any problems. But some people go on with pre-diabetes or even diabetes for several years without knowing it, especially if you don't go to the doctor regularly to get checked for your annual checkup. We always recommend that you get your blood sugar tested, and as your blood sugar continues to rise, have your A1C tested. This is kind of your blood sugar over a longer period of time, so it gives you more of an accurate reading as to whether you're getting close to becoming borderline diabetic or if you're going to jump straight over prediabetes and get labeled as a diabetic. Because it's concerning because there's a lot of problems that can happen with your body when you have prediabetes and diabetes. Some of them include you can have strokes, you can have eye problems, you can have heart disease, or it can lead to type 2 diabetes. And if you start to have type 2 diabetes, you can have further problems with your eyes, such as diabetic retinopathy. You can have problems with your kidneys. Here in Person County at one of the local dialysis centers, 40% of the individuals that are there getting dialysis are there because of their diabetes. It's weakened their kidneys. It can also cause nerve damage, whether in your feet. You can get neuropathy, which is you lose feeling, you lose sensation, typically in your feet or your toes. So if you get a cut or a nick or some kind of thing, it can lead to an infection, and then that can further cause problems, and you might have to remove a toe, or even some people have gone on to have to remove the entire foot. So we don't want you to have any problems, but diabetes and prediabetes is something that affects you from your head to your toe. So what can you do if you're getting higher blood sugar? Well, the basic things. You can eat healthier. Eat a more well-balanced diet with fruits and veggies. You can try to lose weight. Even just losing 5 to 7% of your weight can make a big difference. And 5 to 7% for someone who's 200 pounds is just 10 pounds. So that's completely doable, and you can make a big change and difference in your health overall. Exercise regularly. Adults are supposed to exercise 150 minutes per week. That's 30 minutes, 5 days a week. So just get up and move more. And then make sure that you check your blood sugar regularly, especially if you are pre-diabetic or diabetic. You can get a machine that can help you test your blood sugar. But every time you go to the doctor's office, you should have them check your feet, have them check your blood sugar. These are just a couple of things to give you some information about prediabetes, because we have a variety of different programs available for you if you are pre-diabetic or diabetic. Check them out on our Facebook page at Person Granville FCS, or on either of our extension websites for Person or Granville County. This is Jennifer Brown. Thanks for tuning in.